Thank you so much to both the Carmens for that fantastic grouping of information that really helped set the tone and was super clear. Hopefully you can hear me. And it really segues well into my section. That's the fun part, in my opinion. So I'm going to be actually telling some stories. All right. So just starting out here, my name is Chloe Delany, and I am a social worker with home and community care. The stories that I'm about to tell are actually not real. So they're realistic. And we see these types of situations in healthcare settings all the time, and unfortunately too much. And some of these examples might feel really familiar or be triggering. So please feel free to take care of yourself as needed, including leaving the room if that's what you need to do. Just wanted to note that finances can be a barrier in accessing some forms of advanced care planning. Not everyone has the $500 to $1,500 to do that, and we understand. There are also free and lower cost options available. They can sometimes be more cumbersome or take more time, but there are other options. And advanced care planning improves, but it actually doesn't guarantee that your wishes will be honored. So the goal here is to try to have these really difficult conversations early on, to be able to have a say in who represents you so that you can maybe not ensure, but have a better chance that your wishes are known. So advanced care planning can reduce future stress and conflict with loved ones during potentially really stressful times, so critical illness and end of life. It also makes our jobs as healthcare professionals much easier. So please do it. Okay. So I'm going to start out talking about Robert. So Robert is in his 70s. He is a retired fisher. He lives independently in his own rustic cabin. His belief system is nature-based. He's into holistic healing. He hasn't accessed healthcare in years. And he has a deep mistrust of the system. He has a few close friends, but mostly he keeps to himself. He has one sister in Manitoba. He saw her briefly last year. However, they have little in common and have always had very different worldviews. So Robert is found down on the floor at home by a neighbor. He was there for 2 days. He's taken to hospital, and it's determined that Robert has experienced a major stroke. The stroke has caused severe cognitive impairment, and he now has limited ability to communicate. Robert will need assistance with all aspects of his care. He remains in hospital. Without any advanced care planning in place, the substitute decision maker role would default to Robert's sister to make the medical and care decisions. His sister never understood Robert's lifestyle, and she herself believes in accepting any medical intervention needed to extend life. So what happens? So just have to plug in here. It's really unfortunate that Robert was down on the floor for 2 days. And there are ways, even if you live a rather independent life, to have some safeguards. So things like lifelines or check-ins, those are really helpful to have in the first place. When Robert gets to hospital, he hasn't accessed healthcare in years, so his next of kin information might be very out of date, which leaves staff working endlessly. I can speak to our ER social worker, trying to find who that person is, who should we call to talk about Robert. We don't know anything about his beliefs or his wishes. And the default in hospital is to provide the maximum medical intervention if it's medically appropriate, unless it's stated otherwise. So here the decision maker is the sister. She's all the way in Manitoba. It's a huge stress on her now to have to consider her brother Robert, who's all the way in BC, and jump in there to try to make some really difficult healthcare decisions for him potentially, in the context of also the grief of having your brother have this life-altering healthcare change. So some of the things that would have been helpful would have been, of course, having a representation agreement. So maybe the sister's not the perfect person to do that role, considering she's in a different province and they're really not that close and they don't have a lot in common. And also in terms of their lifestyles, if she doesn't agree with it, she could potentially make a decision that wouldn't be in Robert's best interest. And the whole goal of representation is that you actually do what the person would want, not what you think is best. Of course, having an enduring power of attorney would also be incredibly helpful, because there's the whole piece about the finances is actually huge. And now you've got someone in hospital, but you also might need to think about how you pay their rent, pay their bills, how to carry on for them so that they don't lose their home. Now we're going to talk about Mina. So Mina is in her 60s. She's single and recently retired. She owns a home and has a tenant downstairs. Mina has 3 children who are not local. She's closest to her oldest daughter, Rose. Mina has written a will, and she wrote this several years ago. Daughter Rose has been encouraging Mina to get her other affairs in order so that Rose can help her if there were ever any changes in her health. But Mina says no, that she's super independent and that she manages her finances with total ease. She calls herself as healthy as a horse. Mina has shared with Rose she does not want to cause any conflict by choosing one child over another to be her enduring power of attorney or her representative. Mina starts to develop symptoms of dementia. Rose is concerned and again suggests discussing Mina's future. Rose asks for a meeting to talk about Mina's wishes regarding her healthcare and future living arrangements, as well as managing her finances. Mina says no, that she's fine and that she doesn't want to talk about morbid things. Mina starts to become suspicious when anyone tries to talk to her about her finances. Property taxes and bills stop getting paid. Mina receives final notices for her hydro and her TELUS. She falls victim to a telephone scam and loses several $1,000s. A stranger is now living in Mina's spare room. Rose is very concerned that Mina is putting herself and her finances at risk. Rose calls Mina's family doctor and speaks to a social worker in the community for support. She also calls a lawyer to discuss the situation. She's told that Mina must meet the legal requirements of capacity to choose representation and be willing to do so. Nothing has been written down as Mina kept all her information in her head. Have I scared you yet? Okay. What happens now? So Mina's wishes are unclear and there is no planning in place. Her family now have to scramble to figure out how to support Mina. Does she need home support? How do we help her to access her banking, to pay her bills, to do her taxes? How do we possibly even evict this tenant? At the same time, dealing with all the emotions of their mom's new diagnosis. This is likely to be extremely stressful for the family. So what do we do here? I think we mentioned before, substitute decision-making is really only if and when the person cannot comprehend that information and make a decision for themselves. But we always have the legal obligation to still ask people about their values, their wishes, and what they would want. We still ask. So we would still have conversations with Mina about her healthcare and her wishes as best as we could. Ideally, she would agree to see a lawyer to see if she would meet the threshold to still get the enduring power of attorney, which is really the gold standard here, and a Rep 9. And if not, as Carmen Sombrowski mentioned, we could be looking at in the future at things like committeeship, which take a lot of time, stress, and money. There's also the Rep 7, we call it Rep 7 All, which covers the basic finances and then also basic healthcare decisions. But a house can't be sold, all those important things that might be needed in order to care for Mina in the way that she needs, it may not be possible. A really helpful thing in this circumstance would have been to have something that we call either an emergency or a legacy binder, which is basically clear instructions of what to do in your home with your affairs if you're not able to manage at any given time. Okay. Lastly, we're going to talk about June. So June is in her late 60s. A few years ago, June had her leg amputated due to complications from diabetes. June has a new diagnosis of cancer, which has metastasized. June and her husband, Mo, have had a challenging relationship for years. Mo has expressed repeatedly that he's exhausted being a caregiver and has shared that he wishes that his wife's life would end. June wants to continue living at home with home supports, but her spouse wants her to go to long-term care. If June loses capacity to make her own healthcare decisions in the future, Mo would be the default substitute decision maker. Their wishes differ, and June is concerned that Mo may not make healthcare decisions that align with her goals. Without any advanced care planning in place, healthcare providers are feeling distressed that if June were to become more vulnerable, her ability to have her wishes known and respected could lessen. So the good news here is that June is still capable to make some advanced care plans if she chooses. June should be able to speak for herself. And I think as a healthcare provider, this is where I'd want to have some of these difficult conversations with June to remind her that the likelihood of the importance of having someone who she actually trusts and would represent her wishes to be her rep in terms of healthcare. So the gold standard, again, would be the representation section 9. Also really important, because she does have this new diagnosis, would be to speak with her care provider and discuss what the trajectory of the illness might look like. So things like treatment options, might she need things like feeding tubes and interventions like life support in the future? What does palliation look like? What does comfort care and hospice care look like? It would be advisable to complete an advance directive and share it with her rep and her doctor. And also consider having separate enduring power of attorney regarding her finances so that she can have control over her portion of the money. So just to reiterate, if you have a bad relationship with your spouse or your child or whoever it might be, adding chronic illness or end of life complicate it greatly. As healthcare providers, we often experience what we call moral distress, knowing that there might be a situation of abuse, neglect, high conflict in a family, and then that caregiver now becomes the decision maker. So these are situations where you might want to talk to a social worker, and we would often also consult with Vancouver Coastal Health Ethics Services to talk about this, because these can be really complex and cumbersome situations. Okay, so finally, just a few words here. Advanced care planning, I like to think of it as like another form of insurance. So we insure pets, cars, houses, and this is just another way, and it's about one of the most important things in our lives. Never too early to start planning and having these difficult conversations. And as Carmen Sombrowski mentioned, please only involve people that you trust, because there is definitely a lot of room for error, especially in terms of the finances. Other ways to plan, emergency binder / legacy binder that holds all your valuable information about how to do what you do and what your wishes are. There's also a Scandinavian term for death cleaning. So the idea is to declutter or organize your life before passing away, and that really can lessen the stress on your family and your loved ones. Can't emphasize enough the filing taxes on time and what that means. Because what happens, going down here too, aging can be expensive. And I think a lot of us aren't aware that home support can cost money, and it depends on your income, but long-term care will cost money, and quite a bit of money. So to be aware and prepared for that. Also, having a relationship with your financial institution, big fan. I can't tell you how many times we've wheeled folks to their bank in a wheelchair from the hospital, just trying to make sure their rent is paid or that their hydro doesn't get turned off. So having someone know your face in the credit union or the bank goes a long way. When I hear people banking at Tangerine to save $11 a month, I'm like, because again, when you're trying to do some banking at really critical times, it's almost impossible over the phone when people don't know you. And then again, the emphasis on a lifeline or a check-in system, really important, so we can hopefully avoid some of these really terrible things that can happen if no one's checking in. Okay. So now we will move on to Kim Jamieson, the Vancouver Coastal Health ethicist, to speak to her portion. Thanks so much.